All right, so we're going to talk about the heartworm disease in dogs. This is by Marion, Julia, Kenzie, and Riley. So we're going to talk about body system and disease, then pathology, and then the physiological impact. Then we're going to touch into some treatment, case study, and conclusions. So to start off, the circulatory system is also called the cardiovascular system. It's basically a network of organs and blood vessels that transport blood throughout an organism. It's important in helping transport oxygen-rich blood and nutrients to the cell, and also disposing waste like carbon. The heart pumps the blood that's carried by the blood vessels and the arteries all throughout the body, and the circulatory system in dogs is very similar to humans, except dogs have slightly more pulmonary veins, which is due to their quadruple posture and metabolic needs. Now we're going to talk about what heartworms are. Heartworms is also called Dirofilaria immitis. It is a mosquito-borne parasitic infection where foot-long worms live inside the heart, lungs, and blood vessels. Heartworm is not contagious between dogs, but it does cause severe cardiovascular and respiratory damage, like lung disease and heart failure. And what causes it is the parasitic nematode worm. A nematode is basically like a roundworm or an eelworm. And the transmission is from the bite of an infected mosquito. And the worms actually mature in the bloodstream over 6 months before causing symptoms. And as the worms grow larger, they physically block blood flow and they clog the arteries. So that's where you have the symptoms like lung disease, heart failure, but there's also coughing and, in some cases, death.
Okay, so I'm going to be talking a little bit about kind of how we know what we know about heartworms. So heartworms were first discovered in 1626 by Francisco Burajo. He observed worms in the greyhound heart, but mistakenly identified them as larvae of a different parasite. So fast forward to the 17th century, Jean-Baptiste Panthot observed the worms and provided like the first description that we have of heartworms. Later in 1856, they were first identified in the U.S. In the southeastern coast of the United States. Joseph Leidy correctly identified and named the parasite Dirophilia immitis. And then later in the 1920s, heartworms were discovered in cats, as well as the discovery of Wolbachia, which is a bacterium that allows the heartworms to survive and reproduce. And then in 2024, my cat Ollie was diagnosed with heartworms. That's him in the picture. And so one of the first things that we did to treat them was got him on an antibiotic to kill the Wolbachia bacterium. And what this does is it significantly reduces the chances of heart failure when the worms die, which is usually when cats kind of have complications. And so now a little bit about the life cycle of the heartworms. So it starts out with a mosquito ingesting the microfilariae while they bite an animal that has heartworms in them. In the mosquito, the microfilariae will mature to infective larvae called L3. And that's Ollie back there. Infected larvae are then deposited when the mosquito bites another host. From there, they'll migrate into the host and mature to L4 larvae. The L4 larvae will then migrate through the tissue where they mature to adolescent adults. From there, sexually immature worms migrate into the heart and lungs. And so this is kind of why in animals that have heartworms, there's a lot of inflammation, which results in coughing. In there, the worms develop to sexual maturity in the pulmonary artery, and then within 6 months, microphilia appear. From there, that organism could be bitten by a mosquito, which will ingest those microfilariae, and then continue the cycle.
Here is a quick 3-minute video showing the pathology of heartworm disease in dogs, and I will just attach the link. So, for the physiological impacts of heartworm disease progresses clinically in 4 stages. The first stage, or the early stage, is when the canine has become infected but is not yet showing symptoms. The second stage, or the moderate stage, is when the symptoms are starting to appear. The third stage, or the severe stage, is when the symptoms increase in severity and it begins affecting the canine's ability to function. The fourth stage, which is often referred to as Cavall syndrome, is when the symptoms have caused irreversible damage, and this stage often leads to death. In the first stage, an infected mosquito bites the skin of the canine. The mosquito leaves heartworms on the skin, which can travel through the bite wound into the skin. This can lead to irritation or inflammation around the infection site. However, at this stage, the canine is typically asymptomatic or has no symptoms. These will start to appear when the heartworm produces new generations. In stage two, the canine begins to show symptoms. The canine will have a dry cough, which does not seem to go away. This cough is due to the heartworms having infected the pulmonary vessels or the vessels of the lungs. This causes inflammation and irritation, which triggers the canine's cough reflex. At this stage, the canine will have some exercise intolerance, meaning they will seem more tired after exercising, have to take frequent breaks, or just not be able to play as long. This is due to the heartworms causing slight blockages in the heart and other vessels. Since the heartworms have been present in the body for a while, the body will begin producing antibodies to try to fight the infection. This antibody production will allow for the infection to be detected with blood tests. In stage 3, the symptoms are now severe. The canine will begin to have dyspnea, which is also known as difficulty breathing. The cough of stage 2 will begin to get worse, and they may begin coughing up blood. The exercise fatigue will get worse, and the canine will be reluctant to play or exercise at all. The exercise intolerance will become general fatigue, meaning a noticeable change in energy levels. In this stage, there are so many heartworms present in the heart and vessels that they will be evident on visual diagnosis tests such as x-rays and ultrasounds. Honestly, I'm not an expert x-ray reader. However, this image has a wonderful blue arrow pointing to where the heartworms are. Stage 4 is often referred to as Cavall syndrome. This stage is deadly if not immediately treated. However, with treatment, the survival rate is still only 30 to 40%. The symptoms from the prior stages will continue to get worse as these canines are severely ill. There will be so much damage from the heartworms, the heart and lungs can no longer function properly and will sound abnormal on auscultation, or when listening with a stethoscope. The liver also enlarges at this stage. There can be high levels of the liver enzyme ALT, which is produced when liver cells are inflamed or damaged. Even with treatment at this stage, there are high risks of long-term disability because of the severe damage to the heart and vessels. Some other common symptoms that start at any stage: anemia or a lack of healthy blood cells, syncope, which is also known as fainting spells or loss of consciousness, hypertension or high blood pressure. This can be just pulmonary hypertension or general hypertension. Right-sided congestive heart failure, which is when the right side of the heart cannot pump the blood effectively to the lungs. Tachycardia or high heart rate, which for dogs is generally over 160 beats per minute, but it depends on the size and the breed. Abnormal behaviors, so anything from their normal, can be a sign of heartworm. Some more symptoms not up here include pale mucous membranes, hemoglobinuria or dark reddish-brown urine, or even jugular vein distension or when the neck veins bulge. Luckily, there are treatments for heartworm. The treatments vary depending on what stage the disease is in. In any stage, the canine needs to be on strict rest and exercise restrictions. In stage 1 and 2, heartworm prevention medications are given to kill the microfilaria. They will also give a 4-week course of prednisone and doxycycline. Prednisone is a corticosteroid that will reduce the blood clots in the lungs, and doxycycline is an antibiotic that will kill the bacteria living inside of the heartworms. After these doses have finished, melarsoline, which is a adulticide, is injected, which kills the adult heartworms. Then another course of prednisone, and then finally, after a month of that course, 2 more melarsoline injections are given about 24 hours apart. This course of treatment is 98% effective. In stage 3 and 4, it is likely the canine will need surgery to remove the adult worms. They will give the same medications as the earlier stage treatments. However, the canine must be stabilized before beginning treatments, so addressing that right-sided congestive heart failure or the high blood pressure, anything like that. They typically only give 2 injections of the melarsoline in these stages as well.
So it's important to touch on the fact that dogs are the definitive host. A definitive host is an organism in which parasites reaches sexual maturity and reproduces, and heartworms have evolutionary adapted to the dog's cardiovascular system, and they can live 5 to 7 years in a dog. Other mammals can get heartworm disease, but dogs are the definitive host. So wolves, foxes, coyotes, any type of dog like that. I was interested in this, and I looked into why cats can't have it. Cats are actually the worms aren't able to reproduce. It's something that they can't grow, and they can't grow inside a cat. So I thought it was really interesting, but they have adapted to be able to grow into dogs and wolves and foxes. So that was really interesting. And the adaptation is the worm size, reproductive cycle, and immune evasion systems fit perfectly in a dog's heart and pulmonary arteries, which is really unfortunate, but yeah.
And then here is some info on a case study from 2018, which is the first report of heartworm in a dog from Lithuania. This dog did survive and was mostly asymptomatic. I can just let you look over this info. We do talk about the real world examples later, but I wanted to include this case study since I thought it was interesting. And the title is up top if you would like to look it up yourself.
Hi, my name is Julia, and this is my section of the project. So for the real-world example, any breed of dog can contract heartworm if they are exposed to it. It's a very common disease. Also affects cats, but it has a high prevalence in animals that are living on the street by themselves when they're not being treated for it. So as of 2022, the concentration of reported cases of heartworm has been higher in southeastern states. So in this graph down here, you can see that there is a prevalence of heartworm disease in probably eastern Texas and like central Arkansas, as well as other states in the south, but primarily in these two states. When treated, success rates allow 98% of canines to experience full recovery, but when it is not treated, they can severely be impacted by the disease. So for some physiological conclusions, understanding heartworm disease is essential because it helps explain how the parasite disrupts normal body functions and why the disease causes such severe effects. So when it comes to cardiovascular impact, heartworm parasites live in the pulmonary arteries and the heart, which can cause the obstruction of blood flow. If you have a parasite in a space where it's not supposed to be, there is going to be some conflict with what is trying to get through there, so that makes sense. This leads to an increased pressure in the pulmonary arteries, and right-sided heart enlargement, and eventually heart failure. So with right-sided heart enlargement, the heart is that muscle is being overworked, so it's getting larger. However, it's not accurately pumping blood through the body, so it's still not being effective. So then with cardiovascular impact, respiratory effects also go in very hand in hand. So the worms also can damage blood vessels and reduce oxygen exchange, causing infected dogs to often develop coughing spells, labored breathing, and exercise intolerance. So again, when it goes untreated, these dogs just their quality of life and their overall health really declines because they're not getting oxygen to their body and to their organs, and so their organs start going into a state of dysfunction. So the systemic consequences of that include the body's immune response to the worms, and their waste products cause inflammation, so they're already getting blocked, and then the extra inflammation on top of that makes it 10 times worse. Other tissue damage, so going back to the right-sided heart enlargement, that's creating more muscle, but that could be impeding on other tissues in the space. And then it can also lead to organ dysfunction. So again, they're not getting enough resources through the blood because the cardiovascular system is currently blocked. So it's really important that these animals do get treated if they are found off the street, or if you adopt a pet and you go to bring them to the vet, because getting them treated for heartworm is a very easy thing to do. It's very curable, and it also will improve their quality of life tenfold. Okay, and then these are our references, and thank you for watching.